Good morning, good afternoon, and good evening, everyone from different parts of the world. Thank you so much for joining us today in our Consumer Healthcare Training Academy webinar series 2022 and beyond. Our today's topic is Self-Care Doesn't Mean No Care by Trevor Gore. As consumers become increasingly more interested in proactive self-care, support has never been more needed. Whether it's health with diagnosis, management of chronic conditions, or making healthy choices, pharmacists are usually the first port of call, often because they were the most accessible healthcare professionals during the pandemic. Our pharmacists see an increase in levels of importance and trust. For our communities, self-care takes the pressure off healthcare system as it enables people to get hold of medicines, devices, reduces both costs and health inequalities. So how can we be a part of this? Today, we will learn about the expanding role of pharmacist communities in supporting your consumers and how your brand can play its part. But before we start, I would like to encourage you to expand your mind by thinking about these 4 questions while listening to our presentations and discussions. What excites you? What concerns you? What would you like to know more about? And what ideas come to you while listening to our presentations and discussions? If you have any questions, thoughts, ideas while listening, please feel free to pop your questions in our chat box. Our team will put together your questions, thoughts to ask our speaker, moderators during and at the end of the sessions. So finally, I'm so excited to introduce you, our speaker and host of the day. And Leslie, curious and passionate about the evolutions of healthcare industry and winner of outstanding contributions to the OTC industry. Trevor Gore has spent over 35 years striving to connect health and wellness brands with their consumers and customers. An impressive communicator and sales starter, Trevor, who is founder and director of Metro Consulting, as well as senior associate at the Consumer Healthcare Training Academy, has established an excellent reputation in the industry, born out of his skills as a neutral leader and trainer, creating real change in people he interacts with. He has illustrated his passion through the pursuit of new ideas, better communications, and a change in the dynamics between people, patients, pharmacists, and practitioners. Let's also welcome our moderators, Dave McCaughan. Dave is a storyteller as bisexual and a senior associate at the Consumer Healthcare Training Academy. Last but not least, Steve Sowerby. Steve is the founder of X Potential, co-founder of the Consumer Healthcare Training Academy. Please, everyone, help me welcome Trevor, Dave, and Steve.
Thank you so much, Cara. Thank you, amazing. And welcome back, Trevor. So always great to have you on the call. Always coming up with some new ideas and really a huge and topical element, this element of self-care, because with all the change that we've all endured over the last 2 years, I think self-care has really become much more important in everyone's lives. Dave?
Absolutely. I mean, I think our discussions over the last week, talking to Trevor, getting ready for this, has got us all reflecting on what we've all been individually doing and been aware of as the 3 of us and our teams. But, you know, even today, I was out at lunch with some old friends and, you know, it just strikes me that inevitably every conversation you seem to have today, once you get past the purely functional reason why you're having the conversation, ultimately gets to something about self-care. You know, it gets to how's your diet? Are you putting on weight? Are you losing weight? You know, how is this affecting you mentally? What have you been doing, you know, to make yourself feel good? It's all part of the self-care world, as Trevor is going to explain to us, aren't you, buddy?
I am, and to answer your question, yes, I am putting on weight and losing weight. As I suspect many people are. It depends where we are in the course of lockdowns or what happens. I've been pity eating a lot of the time. and not always the best. So like many things in healthcare, there's an element of practice what I do, not what I practice what I say, not what I do.
Yeah.
But thank you for inviting me, guys, to talk about self-care. It's something I've been passionate about probably my whole working life, was when I started working in pharmacy. But I will rush on, and I know you'll feel free to leap in when you've got a comment or a question.
Oh, absolutely.
Excellent. So we're going to look at what is self-care. I'm slightly concerned that a lot of the pharma industry, especially consumer healthcare industry, thinks self-care is get it on a supermarket shelf to make it easily accessible to everybody. And that is a part of it, but it is not the whole part of it. And I think we're missing out on some healthcare professionals who can really help us. And when I go into it, lockdown and COVID has thrown different healthcare professionals very high up the chain now of where consumers are now going. And it's in many ways, it's undoing a lot of what has happened in the last 4 or 5 years where pharma companies were bypassing pharmacists, for instance.
Yes.
They're coming back in with a bang. Why it's important, what outcomes are, and it's happening now. In the UK where I am, we've just finished our self-care week, and I know there's self-care weeks all over the place. Health literacy, again, another favorite topic of mine. You can't have self-care if people don't know where to go, what the information is, etc. The role of pharmacy and the role of digital. I've spoken many times on digital. I'm a huge fan of it. I'm a geek. I've got all my bits and bobs on. But do see it for what it is. It's part of the ecosystem. It's not an ecosystem on its own. I see many companies saying this is our digital thing. Your digital strategy should be a strategy with digital being a pillar of it, not this is a digital strategy completely on its own. Yeah. So the World Health Organization describes self-care as what you see there. I'm not going to read it to you, but there's some important things within that. It's multifactorial, it's individual, it's families, and it's communities. So it's everybody at all levels of society. Self-care is really important, and it's with or without the support of a healthcare provider. So that immediately goes against what many pharma companies have done in saying, let's just whack it on the supermarket shelves. Don't forget the role of the healthcare provider. I have a lot of sympathy with pharma companies who have treated pharmacists as sales prevention officers. You spend your millions on TV advertising it, and people walk into a pharmacy and the pharmacy says, you don't want that, you want this. So let's bypass the pharmacist. But people are going back to pharmacists now, because in many communities around the world, they were the only healthcare professional you could see during COVID. And even in the UK now, getting to see your GP takes up to 4 or 5 weeks. It sometimes takes 4 or 5 hours to get through to them on the phone. So around the world, pharmacists stayed open and are continuing to stay open. So their role, and I'll talk a lot more about their role a little later on, but all healthcare professionals are part of the self-care agenda. It's not just you're on your own, buddy, sort yourself out. Yeah,
Trev, this is really interesting because it really shows that actually self-care is a very fluid definition. It can change depending on your need. And it can include doctors, it can include pharmacists, it can include the individual and their family on their own. It depends on their need at their particular time, whether they are maintaining health, whether they are managing a health condition that they might have, a chronic condition or an acute condition, and also when they are returning back to health as well. So this is really difficult for an industry that has traditionally been quite compartmentalized. We've had consumer healthcare, or OTC medicines, as they were once called. We've got the prescription and the doctor's side, and we've got, if you like, the wellness industry. So industry has always been very silo thinking, and now we've got to think differently. We've got to take away the silos, and we've got to put the consumer right at the center of everything that we do.
I think that's so true. I think in a couple of slides, it's the self-care continuum.
Yes.
It's about dependency and interdependency. So it's everything from what we traditionally think of as self-care, as I've got a cold, I've got a sore throat, nip along to the pharmacy or the shop and buy something, up to people with chronic conditions, but managing them at home with help.
Yes.
That's still part of self-care. And you're right, we do as an industry tend to silo things and talk about our brands or even our category, which is not how consumers think. Consumers think holistically about their health. Yes, I've got a headache, but I've just had my COVID jab and I need to lose weight. Well, there's three things going on there that are all interacting with each other.
Yes, indeed.
Yeah.
It involves all these things. And the first thing that it involves in self-care is preventing yourself getting ill, avoiding unhealthy lifestyle habits. As I said, during lockdown, my weight's gone up and down. I discovered that gin is now a breakfast drink, which is nice. Not really. But it's about
goes well with cornflakes. Yeah.
Absolutely.
Yeah, very good.
But it is about choices. Nearly all of self-care is about choice. It's about choosing what to do, what not to do, choosing to be physically healthy, choosing to be able to recognize your symptoms. And I'll come on to that, because underpinning just about all self-care is health literacy.
Yeah.
You can't practice self-care if you don't know who to see, what's the right thing. And I think COVID has thrown up, vaccine hesitation and the misunderstandings and misinformation that people have about their own bodies. I'm always amused, stroked amazed, on a Friday night when I used to be able to go out for a drink. Without fail, a friend would come up and throw a box of tablets in my face and say, "What are these for?" And I'd say, "Why did you go to the pharmacist or the doctor?" And they say, "I went because I had a bad back." And I say, "They're for a bad back. Medicine's not that difficult a concept." But people are, or were, quite disinterested. There was this hierarchy of healthcare professionals, told you what to do, you went away and did it. Now, because of Dr. Google and people's curiosity, they're going in with a list, which doctors hate as well, by the way, when you go in and say, "I've done a quick diagnosis, I'm suffering from a brain tumor." And they say, "No, you've got a headache." But the power has shifted. And we're seeing this a lot throughout all of healthcare. The power has shifted from the healthcare professional to the internet, to the informed, but also to the retail level. It's shifted from manufacturers to patients.
Yeah. We had a really nice quote yesterday at the Nicholas Hall Asia conference. 10% of all searches on Google are for health-related matters. So that's 1 billion searches every single day on health-related. And people have never been, well, let's say, I was going to say, have never been more informed, but indeed never had the access to as much information as they have in these current times.
And I think that's the thing, access to information, and why pharmacists came back into its own, sort of bleating on about pharmacy, but they absolutely came back into their own because of access. People could get to, they couldn't get to their A&Es, they couldn't get to their GPs, they could get to their local community pharmacist. And the clue's in the name, community pharmacy.
Yes, indeed. Indeed. I think we're going to talk a little bit about pharmacy later, Trev, because we've got a question from Emma, which I'd like to raise about that. Okay.
Absolutely. So there are 7 basic pillars of healthcare, underpinned, as I said earlier, about knowledge and health literacy. And, as you just said, people can go online and get information. Is it trustworthy information? Is it Wikipedia information? Wikipedia isn't necessarily true. The rumors about me and Britney Spears, they're a lie. But I did put them on there. But another thing that's cropped up, especially during COVID, as part of self-care, is mental well-being. A lot of people have struggled, and that is now part of mainstream communication, mainstream people talking about, and some very high profile people have talked about their mental struggles with that. And what used to be hidden away under a stone is now, it's acceptable to say, I'm struggling with it. I really am. Physical activity, eating, avoiding risks, good hygiene. We're all now, even as I sit here on my own, I have my little bottle of hand gel with me. I take it with me. And the rational use of products and services. And my question stroke challenge to the industry is, I don't think there's one place where consumers go to get advice on all of the above. Again, we're siloed. And I think the industry could do a lot more to provide good, unbiased, don't plug your brand, talk about how people can get what their physical activity level should be. I know Dave and I have talked before about the 10,000 step thing that we're all meant to be doing, and it's just because of a translation way back when. There's no science behind 10,000, but everyone's following it. The healthy eating, Even around Europe, UK, it's 5 vegetables a day, 5 fruit and veg, because that's what they thought they could get away with. And it's different in every country around the world. So where do they get honest, unbiased, useful information from? I think something in industry needs to start looking at in a lot greater depth.
And I think interesting. Trevor, interesting, Trevor, because working with some pure pharma companies, working with companies like, and I'll say Nestle, you know, for what it's worth, and other big global food companies. Over the last 20, 25 years, I've heard every one of them talk about the fact that, well, what we want to do is based around this particular product, but what we want to do is to give people access to all the information and holistic. And quite often what it ended up was, you know, in the package, there was like a square inch on the very convoluted document you opened up that told you stuff you don't understand about the actual product. If you looked hard enough, you'd find a square inch that said you must have a balanced diet and do some exercise to make this really effective, right? Or now, these days, it'll be buried on page 97 of the website. But it's sort of interesting because lots of, I mean, and I'm not being derogatory, some brands do more work in this area, but it's interesting to me because everybody has said for the last 25 years what you've just said, but almost nobody really makes any big effort to do it. And it becomes a case of, no, but I'm actually selling this, so I will sort of give away a little bit of information, but I don't want to distract from this, right? As opposed to, I don't know, wait a minute, why don't you tell people what they need or give them access to what they need on a more balanced consultancy thing? It's always amazing me too that they don't turn this into more consultancy type services, right? With the access we all have to all these online capabilities.
My ex-colleagues at Reckitt will know me well for, I always used to say, the brand is the end of the communication, not the beginning. Talk about the other stuff, talk about the vision, and then at the end, how your brand can help them. Don't lead with the brand. Because it's an immediate turn-off.
And I just want to sort of give a shout out really to some organizations that are starting to take this element of the mental well-being on board. So I'm now starting to see real evidence. Certainly they're talking more about it. We're starting to see products and services and information to support the mental well-being in different conditions. And I think this is going to be one of the major enablers for better self-care, because, you know, Trevor, I'm always going around saying that, you know, the best medicine, it's not the pill or the potion or the lotion. The best medicine is the individual who is informed, empowered, and inspired. And that inspiration is what is going to, in many cases, really be the driver of great self-care and great health outcomes for that individual and their families.
Absolutely, absolutely. And I'm quite pleased that mental well-being and is becoming a focus for a lot of people now, because it has been sort of hiding in the shadows for a long time. It was always there. It's not like we've invented a new illness. It was always there, but people weren't comfortable to talk about it. And I think it's a positive step that people now are.
Okay.
This was the spectrum I was talking about. It's a continuum from being independent to dependent. And it's the gap in the middle, you know, even talking about omega-3s, diet, self-treatable conditions, but long-term conditions. I'm a type 2 diabetic, and for my sins, having told you my weight's been going up and down, I've been summoned to my diabetic nurse next week, who's going to tell me my diabetes isn't under control. Something I knew, but I'm you know, I'm in an empowered, informed position, which many people aren't. So I will be able to tell her why I've been non-adherent and all the other things. But it's across a whole.
So you're going to be coherent in the way you explain why you were just ignoring all of that, right?
I'm going to come up with some justifiable excuses to me, which she won't find justifiable at all.
Yes. But in many cases,
and Trevor, thank you for your last public talk with us.
I did.
It's been nice knowing you.
Carry on, Trev.
Okay. I like the cartoon on the left, and I've used it many times before. One of my passions, as you guys know, is behavioral economics and why do people do things they do, because we're not logical creatures. Just about everything we do is highly emotional. And the phrase prevention can be troubling for some people, because, you know, we know loss aversion, people are twice as likely to avoid a loss than get a gain, and prevention sort of positions itself as there's a gain to be had over there if I do this, rather than there's something I might lose if I don't. So I think wording needs to change a bit and understand really what we're trying to do. And there's a lot of biases go on. Cognitive bias is one of my specialist subjects, but there's a huge amount of biases going on in medical talk to people. It's still in many cases hierarchical and patriarchal, telling people what they should do for their best. There's a phrase that's appeared fairly recently in the UK, don't talk about me, talk with me, sort of thing. Don't tell me what to do. And I purposely, when I was talking about my diabetes, the old phrase used to be, are you compliant? And compliance is follow your orders. Let's have a plan together and see if you can adhere to it. So I said, I'm not adherent. So I'm not adhering to the agreed plan. But words like that are quite important, because people come away from a huge number of conditions. People come away from the interaction not having understood a word the healthcare professional said. Because they're in the car headlights. I've got what? Okay, yeah, fine. And we're pretty bad at asking questions, and doctors are pretty bad at asking the right questions. You know, every healthcare professional I've ever met has ended the consultation with, do you understand? Well, what answer do they think they're going to get? Everybody's going to say yes, then go outside and say, I didn't understand the bloody word of it. So, you know, decent questioning, consultative type questioning to get the best out. What is it you understand? What are you taking away from this meeting? Those sort of questions are far more useful. So I just think words are important, and we sometimes get them wrong.
But Trevor, that means that as companies, as organizations, as teams, we've got to spend more time deeply understanding the people that we want to talk to and we want to transfer the information to, because we all receive this information and process it in a slightly different way. And therefore, something that might be inspiring for me may not be inspiring for you, and certainly maybe something that is completely rejected by Dave. And if I want to be talking to you, then I need to change the way I speak to you in order to ensure that you know, understand, and then are inspired and believe in what we're talking about, and then act to make it happen.
Yeah, I'm thinking I'm going to leap into marketing for just a second.
Okay.
But it always amuses me that no company sets out to launch a flop. They all set out to launch a good product, and they all do their market research, asking their intended consumer what they're going to do, and everything they launch always gets a top box, going to buy it, I'm rushing out to buy it now. And yet 70 or 80% of launches are failures. Why aren't people looking at the methodology? They ask the wrong questions of the wrong people at the wrong time. They bring them into a room in an office or in a hotel, give them bickies and say, do you like our product? You're never going to get an honest answer, and that's not how people shop. They don't shop in isolation, in a vacuum. They shop when they're doing a big shop, and your wonderful product is one item of 360 that if they walk past it in the shop, they can't be asked to go back and find it. It's I mean, a lot of the failures are because they don't really understand the client or the consumer.
Well, and again, I don't want to go too much into this because we'll spend the next few hours talking about it. I think it's about lazy thinking. I think a lot of times we go for the superficial reply that the consumer is giving, and we don't ask the question about why they are thinking, or they're saying and believing and behaving like that. But I think we need to move on, or else we'll be turning this into a market research.
Indeed. So tons of benefits of self-care, both for individuals and healthcare systems. And I think it's important in the academy, we always talk about win-win-win. Everybody's got to win. So pharma companies have got to win, the individuals have got to win, but systems have got to win as well. Because without the system winning, individuals won't get a chance to practice self-care. And so just some astounding figures to me. You know, in the States, every dollar spent on OTC saves 7. In Latin America, £3 billion are used in the treatment of non-serious conditions. Across Europe, if 5% move from going to see their doctor, that would save 16 billion euros. And the savings are phenomenal. because it's not just the cost of the medicine. Some health trusts in the UK have recently published this chart, which is interesting. So self-care, pharmacist or supermarket, is where you go to the pharmacy or you go to the supermarket and you buy it. GP and pharmacy is when you take up the GP's time, who writes you a prescription or says, go to the pharmacist and get it. And then walk-in centres and A&E are self-explanatory. The leap in costs from going to do it yourself to going to get a GP to prescribe and a pharmacist to dispense are phenomenal. Pain, pack of paracetamol, 59p is quite expensive, by the way. I can buy paracetamol for 18 pence at the moment. But it goes up that to nearly £32 because you're not just paying for the drug, you're paying for the receptionist time, the GP's time, the pharmacist's time, the movement of information for the pharmacist to get paid, etc. And once people begin to understand this thing, I mean, we're very lucky in the UK and unlucky at the same time with our NHS, that people are wedded to it, obsessed by it, and want to save it money. So when they've seen this sort of data, they go, ooh, well, that's ridiculous. You know, I'm wasting half an hour of my time to get a pack of paracetamol. That's costing 31 quid to the NHS, and I could just go and buy it down at Wilko's for pennies.
When you showed me this chart, I commented before, it's just mind-blowing, right?
It is.
And of course, we know it's magnified in some other countries to a much worse extent. So,
yes.
You
know. But Trev, do you think it's a consequence of systems like the NHS being seen as free and therefore seeing it as having less value than if in other countries you have to largely where you can afford it, you go private? And it's a choice. And then I'm not saying that self-care is more dominant in those countries, but I think that we suffer in the UK with NHS has been a wonderful and amazing free system for care, and everyone really takes it for granted. I have an illness, I'll go to the NHS. I won't think about it first, whether it's something I can self-care.
I think that's true. And I think one of the things is it's a right, and with rights come responsibilities, but nobody thinks about the responsibilities. We could spend every penny of GDP on the National Health Service and we still wouldn't solve any of the problems.
Correct.
Really.
Correct. Exactly.
I think one of the issues is the language. So it's free of charge at the point of need. It should be free at the people are treating it free of charge at the point of want. You don't need a pack of paracetamol.
No.
You want a pack of paracetamol. And I think it's that sort of language that changes people. And I think in a way, COVID's done the NHS a favor by not being accessible to everybody and them having to find other ways of looking after themselves.
Yeah. Yeah.
Certainly pre-pandemic, it's nearly double the amount of people, you know, it's gone from 55 to 95% said, actually, it's important that I take my own responsibility.
Because in most countries, we weren't able to see our doctors during the pandemic. We had to. We were forced to think about what we could do. And the only accessible point of care was the pharmacy, where we could still go and it was still open. Absolutely.
But the other thing was the things we're asked to do around the world, wear your mask, wash your hands, maintain safety, is self-care.
Yes.
Yeah.
That's exactly what self-care is. Take responsibility for your and society, your families and society's health. I know you guys are in the East. Well, Steve, you're not, but generally you're in Bangkok and Australia.
Yes.
They've understood the wearing of masks for decades. It's not about protecting themselves, it's about protecting society. It's stopping spreading disease. They've understood it. And I still don't think a lot of the West gets that. I think they wear masks to protect themselves rather than protect families and communities. This was a study done in the State Centre for Disease Control about what would happen to the capacity of healthcare systems without the protective measures people took. It would have peaked a lot earlier and cases would have been out of control if people hadn't taken those self-care actions that governments are asking to do. This is from the Self-Care Federation. It's a messy slide. I apologize. It's only one thing I want to focus on. So it's all the usual stuff about get enough sleep, wash your hands, take breaks for your mind, which was nice to see. Nice. But just there next to the left of the big box in the middle, consider taking a daily multivitamin fish oil. So even in self-care, just general how to look after yourselves, there is a place for pharma companies to get their products exposed to people and educate people about what the benefits of these things are. And you know, not branded, not saying ours is the best. It's just let's start the discussions. I've frequently said it's the difference between growing your slice of the pie or making the pie a hell of a lot bigger. And I think with nearly all healthcare conditions, if we can get people to self-treat and understand what they're doing, the pie will grow exponentially.
Yeah.
And then whatever share you had before, even if you keep with the same share, it'll be a lot more. Stop trying to kill each other to get a little bit of a diminishing pie and work together to grow the pie. 8 out of 10 people say they should be doing this sort of thing. This is relatively new, the Self-Care Readiness Index. It only launched about a month ago, and it's self-care industries from around the world and the regions looking at what the issues are and are they ready to practice true self-care. And there are challenges, and so they've done this largely around the world, and it's a term that's confusing. And as I said at the beginning, some people think it's just get your product on the supermarket shelf. It relies on individual empowerment, but having credible sources of information. And then legislation around the world is different. I understand in Australia, Dave, something's just recently happened. There was a new launch of a self-care foundation in Australia, and they're looking at what to do over there. So around the world, it's not joined up thinking. The thing is, on the line now, we've got big, major, multi-global pharma companies who are in all these areas, who could be part of the conversation.
Yes.
And there's a place for them in self-care. There's the Global Self-Care Federation, but there's local ones. There's a European one, there's a UK one, there's an Australian one. It's getting our voice heard, but putting our egos on the back foot, maybe?
Yes. And I think it's that, I mean, we've touched on it before, that the theme of collaboration is really important in ensuring that we're able to provide a good framework for self-care for consumers. We can't do everything ourselves.
No.
We have to collaborate with partners, with government agencies, with other companies, and we can provide then a really good infrastructure that is seamless as far as the consumer is concerned. Because at the moment, it's the consumer that has to go and find information about things. How can we as industries work better together so that we can make it easy for them?
Yeah, as you know, I'm on the board of advisory board for the Institute of Collaborative Working, and collaboration has been the core of what I've done for my whole working life. Decades ago, when I worked for RB and we had Gaviscon, myself and a lady who's no longer in the industry, Sarah Nesbitt from GSK, did a collaboration on the treatment of indigestion and heartburn, and took our rival brands out of the equation and talked about how we help patients, and agreed that for some Zantac would be the right product, for others it would be Gaviscon, for others it would be Rene, for others it would be just lifestyle advice. And we took our egos and it was a great success. And then a new sales director took over, and that was Kai Bosch.
Oh, right.
Yeah. I mean, you see that in waves across lots of industries, right? It's actually interesting, Trevor, because and I can find these if anybody's interested, but it's just interesting. In the last couple of weeks, I've seen 4 different studies that have been done in different academic or semi-academic journals related to marketing, all pointing out the advantages of collaboration. And so we're sort of, it just struck me, it's one of those things where when you see the same subject 3 times in a week coming from different sources, you go, oh, that's a trend. The only problem is I'm old enough, like you two guys, but especially me, I'm old enough to remember this trend happening 15 years ago and 30 years ago.
Yeah.
So, but hopefully it's a trend that we can see sort of clicking through, and people start to realize this.
Well, the good news is Australia has just opened a branch of the Institute of Collaborative Working.
There you go, Dave.
There you go. Yeah. You're on the way.
Change is on the way.
So again, around the world, Brazil, health literacy is fundamental. In South Africa, they're building an online directory of OTC medicines to help people. We're not very good at communicating because our communication is imprecise. I put this slide up at a talk I was giving to pharmacists, nurses, and doctors, and said, my prescription says one to be taken 3 times a day. What's the interval between taking them? And the answers range from 4 to 8 hours, depending on what you classify as a day, working day, a 24-hour day. Now, if that's an audience of healthcare professionals, what chance have the public got of getting it right, their dosage? Take with food. Does that mean I take it with all meals? If I don't have a meal, do I miss my meds? One of my reasons my diabetes is out of control. I don't do breakfast, but my medicine says take with food, so I don't take my morning dose. And I'm not the only one. 2 times a day. Is it 2 times from when you get up to you go to sleep, or once every 12 hours? Do I have to get up in the middle of the night? We're not very good. So a lot of companies are working on health literacy, but in silos and isolation again. They're doing their brand and about their little area of the world, instead of let's expand it to everybody, because you can't have self-care without health literacy. And the benefits of health literacy are phenomenal. People who have low health literacy have higher mortality rates, is the bottom line. They die earlier, but they're less likely to follow treatment plans. They stay in more hospitals and are more likely to visit emergency rooms. And this isn't about we'd have to give them more expensive medicines or whatever. This is about get them to understand their body and their options, where they can go. And it's not a third world issue. This is a survey done on health literacy in 8 European countries. And you'll see Germany at the top, 55% of problematic or inadequate health literacy. You go right to the bottom, and it's the whole of Europe as a whole, 47%, nearly half the population have problems or inadequate health literacy. This is a global problem, and we're all, one of the things I think it's funny we do, we try and make it easier. And I'll show you an example in a minute, but we come from a position of we're educated, intelligent people who know it, so we'll write it down, and therefore you should know it as well. It's paternalistic, do as I'm told. But basically, people with poor health literacy can't engage in self-care, and health literacy is a stronger predictor of an individual's health status than income, employment, education, or racial or ethnic groups. And there's been a lot of talk in the UK over COVID that different ethnic groups got poorer outcomes during COVID for a whole variety of reasons.
I think that's true in most countries, that we're seeing that, ethnic diversity or ethnic-based diversity in the ability to cope with pandemics or the reactions, the knowledge, all those sorts of things.
But health literacy is a bigger problem.
We can't all be upper middle class.
No.
University educated white people.
No, and this is a real bugbear which I personally have, which is good health should not be a privilege of the people who are of a class nature. So it should be something that's available to the population, and this is something where in developing markets, which Dave and I, of course, call home, we have huge rural and rural populations who really just do not have easy access to great health systems. And so how do we improve the health literacy of the entire population, not just the few? And that, for me, is still an issue which we haven't tackled properly.
I agree. And a rhetorical question to all our listeners. We spend a lot of time and effort and testing our insert pack leaflets, and nobody reads them.
Yes.
And I would ask them, have you ever read any of your pack leaflets? One of the things, certainly in Europe, we have to do now is put risk on there. You have a 1 in 10,000 chance of liver failure if you take this product. But the vast majority of the people have no idea what that means. The ability to understand risk from a number.
Yes.
You can tell a minute. Does that mean if I take it 10,000 times, I will have a liver failure? Does that mean if I'm one of the 10,000 people, I might get it? Does it happen on every 10,000th day? We don't understand risk. And we don't follow instructions anyway. There's a sexual bias or a gender bias on this. If a product says 1 or 2 to be taken 3 times a day, men read that as 2 to be taken 3 times a day, and women read it as 1, but I'll try and skip a dose because I don't want to put anything in my body. Whereas men, we're strong, healthy beasts, and we want as much painkiller down as we can get.
Well, of course, we feel pain more than women do, so we need.
And flu is a thing.
Man flu, definitely. It is a known condition. So right.
To get away from that, quite often we use icons, pictures, because they're universally useful. I'll go through this really quickly because it just makes me laugh. So we all think we know what that means. Don't give to a kid. And don't give this medicine to babies is in a survey. This was sent out to 10,000 people, what they thought about it. Some thought it meant keep out of the reach of children.
Yeah,
You kind of get that. Don't take this medicine if you're breastfeeding, I struggled with. Don't take this medicine if you're trying to get pregnant. Not only did I struggle with it, I tried to think what other caption they could have used.
Yeah.
And then finally, if you take this medicine, you will get pregnant, at which point I gave up. But even pictures are open to interpretation depending on your culture and on your own background. Sorry about the fuzziness of this. It was a screen grab I did. Some companies are starting. GSK not only are doing this in Sweden, I read yesterday they've started it in Germany as well. They're launching educational campaigns, not about their brands, but on the wider concept of responsible use of medicine. So some companies are sort of taking not a holier than thou approach, but this is a problem, let's solve it outside of our brand.
But Trevor, before we move away from literacy, I have to tell this story because it was such a great example of health literacy, which is my mum, bless her heart, has just had an operation and she's under a very, very well-known consultant. And she had a question about the dosage of a particular painkiller that she was given. And the consultant was not really clear on what should be that particular dosage and how often to take it and when to stop taking it. So he said, well, I'm not really sure. Ask your GP. She asked her GP. GP said, well, I'm not really sure. Maybe we should ask someone else. So we had to go directly to the company that produces this particular product. And even the person I was talking to was, I'm not really sure. Let me read the license. And bless her heart, she went and read the license and came back with the answer. So it's not just consumers who have a lack of health literacy. It is also sometimes our healthcare providers, and in some cases also the individuals within our companies that are giving advice. So we have to make sure that this is across the board, not just putting everything on the consumer.
Absolutely. I've just been working on a report for UK community pharmacy, and 1 in 10 prescriptions that the average community pharmacy gets is wrong. It's a wrong dose or the wrong timings, or it's wrong. And you know, this is common around the world, which is why pharmacists, I'm not an apologist or an act like a pharmacy, but they're medicines experts. Doctors are disease experts. I said years ago I would change the way medicine's practiced in the West. I would go to a doctor and he'd say, you've got high blood pressure. Take this paper to the pharmacist who says you've got high blood pressure. I'll decide which is the best blood pressure medicine for you, because they understand medicine. Doctors understand illness, and they're different things.
There's nothing scarier than when you're standing waiting for your prescription to get fulfilled at a pharmacist, and you hear that, and somebody else walks up to the counter, and the pharmacist looks at the thing for a couple of minutes and then go, are you sure you need this? You know, which I always figure is like, it hasn't happened directly to me, but I've just noticed in the last few months, I've seen that twice. And I just saw the look on the person's face is like, literally, how the F would I know? I mean, you know, it's like the doctor gave me this, you know. So.
I always say when you're sitting in the doctor's surgery, if he has to look at his computer what the dose is, you're in trouble, because it's not a drug he uses a lot of.
Well, and they do. Trev, Coulton has just posted a question on the PIL, the product information leaflets, and he's always wanted to convert them into infographics, but his regulatory team tell him, no, it has certain legal requirements. How can we start to influence our regulatory agencies to change into the new world and go away from this legalese and overfilling the PIL with lots of information that people actually don't read or don't understand?
I think it's a really good question, Coulton. One of the challenges is regulatory follows usually about 2 years behind practice. And people are doing other things all the time. I know many pharmacists who print out for varying conditions their own label of information that doesn't contradict the PIL, but it makes it English. I think I think I know we test PILs, but again, we don't test them in the real world. We test them in a room, getting people to read them. I think getting some real life data, and I think generally across the board, real world data is becoming a more important thing than anything else, than what your clinical studies showed or what your behavior studies showed. So get some real world data, how patients are really using this thing. And don't try and solve it within a company. The we have the MHRA here in the UK, is look at the regulatory authority and say, what we are giving patients isn't fit for use. And this is what we'd like to do. Let's test it in the real world, not in a pharmacy or a lab, and see what we can come up with that is better. I mean, they're 100 times better than they were, but they're still less than 100 times as good as they could be. Work together as an industry, work with the regulator. Don't just think it's a problem within your companies and your regulatory team. It's a problem across the industry, and collaborate to say this is a nonsense. We're not helping people, and nobody's reading them anyway. Pharmacists are loved. It went up 47%, up from 37%. So they go there for initial advice. So pharmacists are loved. But what do pharmacists do? And it's a big challenge around the world and within the industry, because I heard UK medical companies, medical reps saying, well, they just dispense medicines. They're not involved in decisions, but they prescribe medicines. A little known fact in the UK, from 2024, so in 3 years, all pharmacy students coming out of university will automatically have prescribing rights within 3 years. They review medicines. They'll look at them and say, Dave, you just said it, are you sure you want this? They review the medicines and they administer medicines. They've been giving flu vaccines and COVID vaccines all over the place. Methadone they give to patients and things. So it's not just they dispense medicines. They do a great deal more. And that's just medicines. They also give a great deal of advice. My pharmacy tutor, way back when I started working in community pharmacy, he was known as Dr. Whaley because people thought he was a doctor. And I'd say 9 times out of 10, his advice was not to take something. He'd say, go home and put your legs up or something for a day or so. So he was practicing that self-care thing 40, a long time ago.
Long time ago.
I was just thinking when that was 35. No, keep counting. Long time ago. But yeah, pharmacists have a role. Again, it comes back to this, it's individuals and community. They're called community pharmacists. It's not just the individuals. How can we help community and care? And in the UK, all community pharmacists have an obligation to run 4 campaigns on public health a year. To get the public in, but it's all these things. And if you think it doesn't affect you, these are some minor ailments. But in the UK, we've just, one of the first countries in the world, licensed Lovema contraceptive pill to be bought over the counter in a pharmacy, so women can take care of their own reproductive cycle, self-care. They don't have to go to the doctor every time. They have the responsibility.
Yeah, Trev, this is probably a good time to jump in with Emma's question, which is, do you think that there will be a shift in the next few years to make the pharmacist more accountable for infant or child self-care? Traditionally, the pharmacist will send the parents back to the GP for children to be assessed. So that particular area, do you think there'll be a shift there as well?
I think there will, but I think it'll be slow because it's the nature of pharmacists to be rule followers and risk averse, and there's more chance of getting it wrong with a young kid. But I know already, from my understanding, the port of call for young mothers is their mother. First port of call, what the hell do I do? Little Johnny's doing this. And then panic, then use A&E. And that's the first time. And then after that, it's the A&E will probably say, yeah, this is quite normal, and it'll be mother pharmacist. So I think there will be a shift, but I think it'll be a lot slower than with a lot of other conditions because of mum as much as anything.
Yeah. Right. But also we mustn't forget, Trev, the increasingly it's mother, or maybe even before mother, online search.
Oh, absolutely. Go online and Mumsnet.
Absolutely.
And the likes of those.
Mumsnet, and absolutely.
Hugely important.
Hugely important. And there we can influence as an industry to have the right information available online.
We found out, again, just going back to my RB days, we found out that mothers start researching children's ailments 3 months before the baby's born.
Interesting.
And stocking up some medicines.
Sure.
Wow.
Getting things in
Wow.
before baby's born. This is I find it a fascinating study, what the is. So eczema, we all know, those of you who suffer from this horrible disease will know that doctors underprescribe and patients wrongly apply. So you're also rub the cream in. No, you don't. You go with the nape of the thing and you cover your arm in it. So most doctors prescribe 500 grams a month. It should be 500 grams a week. So this was sponsored by Leo, so a pharmaceutical company trying to really understand it. And they had a pharmacist embedded with a GP practice who saw 932, I think it was, patients who had been diagnosed with eczema. And over the course of a few weeks, they corrected their frequency of use. So if you're a company that makes an emollient, you suddenly got a 4 times increase in your sales because it went from 500 grams monthly to 500 grams weekly. They corrected the application technique, so don't rub it in like a maniac. But for 513, so over half of patients who had been diagnosed with eczema, they added an emollient. Imagine if you're an emollient company to get that. So pharmacists are helping people manage their conditions. And the bottom line is the outcomes were better for the patients because that's what matters. Yeah. They were spared adding in steroids, they were spared flare-ups, etc. So getting pharmacists involved in monitoring treatment and adapting things, because the doctor just writes, looks like a bit of eczema, 500 grams, put it on twice a day, off you go, doesn't help. Pharmacists do. So I found that a really interesting study. And one that talks to me a little bit is a Nielsen study that said consumers with diabetes spend over 1/3 more on OTC products. So again, if you're thinking holistically about the patient rather than about your brand, is, diabetic patients, what are they looking at? It's eye care, it's foot care, it's skin care, it's diet, it's prebiotics, it's probiotics, it's all these 1,000 things which you wouldn't necessarily think are of interest to your brand, but they're interested to the patients who might need your brand. Right. It's getting it. I'm going to rush a little bit. This was a great one by Nicholas Hall and BMI. Over the years, a lot of pharma companies have said, we don't need pharmacists. They don't really impact my brand. So this was, does pharmacy recommendation affect market share? Without going through all the details, yes, it does.
Look at all the greens,
all the greens, particularly if you're a secondary or challenger brand. But I would say to the primary brands, if you aren't seeing this sort of stuff to see what the secondary or challenger brands are, you will soon be a secondary or challenger brand, because one of the ones that pharmacists are beginning to recommend will overtake you. So absolutely start looking at what pharmacists recommend and why.
Yes.
So pharmacists, they're underutilized. Patients want them to do more. Dave, you'll have heard it, and I do every time I go into pharmacy. Oh, couldn't you just do this for me? They're proven to improve outcomes. And they're in the right place. They're community pharmacists. Final 2 minutes on mobile. We've all got them. Be careful with digital health and what you're talking about. There's digital health, digital medicine, and digital therapeutics. The more you go to the right, the more clinical evidence you need to say you're doing something. So at the moment, a lot of companies are in digital health, lifestyle reminders, medicine reminders, patient portals. When you start doing diagnostics, etc., you start becoming digital medicine, and you might have to register as a medical device, all sorts. So do check what area you'll want to enter into. There are 2 types of human being. There are ones that when driving along and you come to be 2 miles away from a service station and your petrol warning light comes on, decide you'll risk it and then spend the next 15 miles panicking that you're going to run out of petrol before you get to the next service station. But also there's those of us who, when you get the check engine sign, go, that's interesting. And now I'm one of them. And I suspect many of you are. I've got my Apple Watch on. I've got my fitness tracker on. And when I go out and do my cycling and all my bits, I look at them and think, oh, that's interesting. Do I ever share it with my pharmacist or my doctor who can tell things? We've just had the launch of a new thing in the UK, and it's a trial that pharmacists are getting involved and have been for years in high blood pressure, but they're getting involved in ambulatory care now. So people wearing these monitors and feeding back so they can see what the real issues are, because we all know the white coat syndrome. When you go to your doctor or pharmacist to get your blood pressure measured, it goes up because you're in with a doctor and a pharmacist having your blood pressure measured. So ambulatory as you go about your day, but we're all collecting tons of data about our own health every day and looking at it and going, that's interesting.
Mhm.
A bit like your car engine saying the engine's about to blow up. That's interesting. And then when it blows up, you wish you'd done something about it earlier.
Yes.
Right.
Our patients are now consumers of health. I would guess every one of you on here is doing something digital about your health.
Yep.
Possibly not sharing it. And the role of pharmacy is smack bed in the middle. It's continuous monitoring of diseases, and your pharmacist helping you with that. Health literacy there in the middle is really important. And the bottom line for me is what self-care is about. It's personalizing it. It's what does this mean to you?
Personalizing is, as we've discussed before, personalizing is so important. And what you've just been talking about, Trevor, when we talk about visualization, I can remember a lot of people I know that looking through who's attending, a lot of people know I talk a lot about toilets, right? And it's the running joke now, the gag for over a decade. But I literally, in my talks, I regularly give about toilets and social media and how they work, right? One of the examples I always talk about is the fact that, the big Japanese toilet manufacturers, particularly Toto, came up with toilets, it must be nearly 10 years ago now, where literally in the act of just peeing into the toilet, as you sat on the toilet, it did everything from taking your weight, doing your blood pressure, right? Doing your pulse check. It took something like 17 measures between the physical activity of sitting on the toilet and sampling your pee as you pee into the toilet, right? It's never really caught on.
Mm-hmm.
And one of the interesting things I heard why it's really not caught on is because even people that bought the thing didn't want to share that information. The whole concept was that you would have a direct link to your doctor or possibly your pharmacist, right? So they could actually see every time you peed, whether 4, 5, 6 times a day, over months, they could actually see all these figures and see, what was really normal for you. Oh yeah, but I don't want to share that information with all the private details of when I go to the loo and stuff. It's like, well, when we go back to self-care, this is what amazes me about the whole the watch, for example, that you're wearing, right? And the Apple Watch or whatever it is. I personally don't wear one, right? But what I find really interesting is the number of people I know that have one and use it as a measure for the things that they want to measure, but are not willing to use the capacity of the thing to share it, right? It's like we're going to selectively look, and we've discussed the fact I have this horrendously low heart rate, pulse rate, right? Which is I've always had. It's not an issue, but people don't want to report simple things like that on a constant basis, right? So that you can get to, is that going to be a problem, etc. So I think one of the issues, what I wanted to say was, when we talk about the digitization of health, one of the things we have to think about is not the selectiveness of it, but the holistic value of it. Yeah. And we have to somehow get people to understand to use it holistically, not, well, I'm just going to use it to check this, right? Yeah. As opposed to how my whole life is.
Okay. Personalization thing's really interesting. I saw a great study that they took the average. I urge you all to do this at work. They took all the dimensions of people in an office and worked out the average. And then there wasn't a single person in the office who was average.
Yes, of course.
The same with healthcare. Nobody is average.
Yes.
We want service for us, not the pharmacy companies should know that when they send reps into the pharmacy and say, oh, an average pharmacy sells 10 of these. The pharmacist says, I'm not an average pharmacy.
Yes.
Stop it. Very finally, this one. This is from Portugal. And it was flu tracking. And they found out that if you track flu or influenza-like symptoms from a community pharmacy, it predicts things 2 weeks earlier than the traditional method of seeing who GPs are seeing.
Yes, absolutely.
It did the same for COVID as well.
Yes.
So pharmacy, and you can regionalize it.
Yes.
So you can see which bit of the country you should be putting your resource and your advertising, if that's your way.
Very good.
Finally, vision of self-care. You should understand and be willing to practice it. There has to be a cultural shift amongst everybody, including healthcare professionals. Pharmacy has to be at the center of it because it's the most easily accessible healthcare professional and available on the high street. And digital technology should support it, not supplant it.
Yeah. Very good. Trev, one last question, because we're almost out of time. What kind of advice would you give? What would be the 4 key points you'd want the audience to take away?
Self-care is on the rise. It's a global phenomenon now. We've got the Self-Care Readiness Index, and pharmacists are key to it. Health literacy is the key to unlocking it, because if people don't know where to go, what the information is they're getting, what their body should be doing, the rest of it's meaningless. As Dave just expertly said, think holistically, not parochially. Think about the brand. And digital is part of it. The digital world is here, but it's not a replacement. It's a help to what the hell is going on in our lives. And the more people we share the information with, the better decisions will be made. And AI is going to be a big part of this going forward.
Brilliant. Thank you so much, Trevor. And I think, unfortunately, we are out of time. Again, it's been very, very inspiring. And this is a topic that's not going to go away. I hope it's really going to be something that really is the first, if you like, step in improving our health outcomes across our communities. If as an industry we can get behind it, support it, help our individuals, our communities to be more empowered, informed, and inspired about their own self-care, then I think we will have fulfilled our pledge to improve the health outcomes in our communities. Dave, any final words from you?
No, I just thought it was really interesting. I'm just noticing a lot of comments from people that were watching it live. Really appreciated it. I think it got a lot of people thinking about their own self-care, as well as obviously the industry issues, which is the double benefit of some of these talks, Trevor.
Absolutely.
It is personalizing things, not just useful for work, right? So
very good. So thank you again, Trevor, and we'll see you again in the next year. Fantastic. Now I'll hand over to Kara to give the final comments for this particular webinar. Kara.
Okay, thank you everyone for joining us today, and a big thank to you, Trevor, Dave, and Steve, for sharing insightful stories, insights, and practical tools with us on how we and our brand can support our consumers with the expanding role of pharmacist community. On behalf of the Consumer Healthcare Training Academy, I would like to invite you all to find us on LinkedIn to continue conversations and discussions. Finally, look out for us in December when Dave and Steve will share a final round of recording of the last 2 years and exciting news on a new series coming out in 2022. Stay tuned. We wish you a wonderful day and the rest of the week. Goodbye, everyone. Bye.
Bye, everyone. Thank you.